On this episode, we'll talk about having breath mints after surgery. We'll talk about Coke Zero and other diet soft drinks, and we'll talk about tailbone pain. Hello everyone and welcome to episode 60 of the AskDrA show. I'm Dr. Alvarez from Endobariatric.com, and we are here weekly with our weekly show answering questions. If you don't know and if you're new to the show, you can always submit questions that you may like answered just by adding the hashtag AskDrA. We'll place it right here on the screen for you. And these questions may be submitted through Facebook, YouTube, Instagram, or Twitter. And my team will pick it up and we'll add them to future shows. So you're always welcome to throw in your questions. We'll add them here to the show. And also, if you like Snapchat, don't forget to add me. You can always submit your questions through Snapchat. That's my personal Snapchat. You can follow me throughout the day and you can always say hello. So let's get into the show.
Can you have breath mints shortly after surgery?
All right, can you have breath mints? This is a very common question that we get in the hospital, and not before surgery. So it's normally the day of surgery. You may have a little dry mouth sensation, and patients are like eager to have something. And they sometimes say, well, can I have a breath mint? Normally, we don't recommend having, this is our practice. In our practice, we don't allow them the first 24 hours after surgery. So you may want to ask your personal doctor, your personal surgeon, how they manage their practice. But normally, we want that stomach dry until the next day. And then the next day, we can start doing some ice. And the idea of the cold ice brings the swollen tissue down. And that's the idea with the ice throughout the next day. But the breath mints, we try to avoid them. We do recommend our patients to use swabs, or they can use they can brush their teeth, or you can rinse and spit some water. It helps with a dry mouth sensation. But remember, you're going to be well hydrated with your IV. You're going to get up to pee. You're well hydrated. So it's just that sensation, the dry mouth sensation, that you can use other tricks and tips like I'm mentioning here to help you with that sensation.
Is Coke Zero better than other diet drinks?
All right, so is Coke Zero better than other regular diet soft drinks? The answer is they're all as bad and crappy. All right, so try to avoid soft drinks, number one. I mean, if you have an addiction to soft drinks, all right, so I'm guilty. So I've been through this, all right? So I've been through this, I know this, so try to, by lowering your consumption daily, if you're taking a whole bunch of Diet Coke or Diet Zero or Diet whatever, you know, they're all bad. They try to avoid carbonated beverages altogether. So anything that still is better, like green tea, etc. So water, some other sources. So drop the carbonation first. It'll be easier to then progress from, let's say, Crystal Light or tea to plain water. All right, so, but the answer is no. Try to avoid diet soft drinks. Try to avoid soft drinks in general. They are not good for you. They're not a good idea. And there's a big plus. Anything that's carbonated will affect your sleeve because it may irritate it down the road. All right, so altogether, try to avoid soft drinks. Go slow. Count the amount you're doing a day. Try to be lowering them, then try to switch to something else, all right? And you can make it happen.
Is the weight loss a contributing factor if I have issues with major tailbone pain?
All right, so this question we could use two ways. So I have tailbone pain. Will this get better or worse once I have weight loss surgery? Well, tailbone pain, if you have it right now, you will continue having it afterwards. Plus, the other thing is, the other question is, can I get tailbone pain after weight loss surgery? The answer is yes, because that cushion is starting to go away. The same thing that causes for the patients to have the number one, what I call the number one side effect after weight loss surgery is being cold. So that fat deposit, the fat layer underneath your skin starts to go away, including the one near your tailbone. So yes, it will get a little uncomfortable if you already have tailbone pain, but normally it's not something we see on every patient. So, but if you do have it, will it continue? Yeah. So it's something commonly seen after a good amount of pounds lost. So you want to just, it's an important thing here. Don't think that because you may get tailbone pain, you don't want to get weight loss surgery, because weight loss surgery will bring you so many benefits, so much more better things and better quality of life, that maybe if you get the tailbone pain, I mean, it's off balance, all right? So it's always much better to get the weight loss surgery and forget about those minor symptoms. There are adjustments, and down the road, everything gets settled down in your body and everything progresses nicely, all right? So don't get kind of negative having weight loss surgery just because you may get tailbone pain, all right? So that's it for episode 60 of the Ask Dr. A show. Thank you so much for joining us, and thanks so much for submitting questions, and thanks so much for subscribing to the channel. That way you don't miss any episodes of the future Ask Dr. A show, all right? So question of the week is, has your tailbone hurt at any point after surgery? The answer is yes, no, down here on the comments section. I want to hear from you. I'm Dr. Alvarez from endobariatric.com. We'll see you on the next episode. Take care.